the really great thing that I love about my job is that I do get to meet every type of person under the sun, and it's really an eye-opener to get to, and a privilege to get to meet and interact with all of these people. I think it's nice to also be able to cultivate that basic human relationship with people in addition to doing all of the clinical things that we need to do. When I'm speaking with a patient, I try to imagine how I would like to hear the news I'm giving them, how I would like to receive the information that I'm giving them, and how I would like to be treated under the same circumstances.
Family-centered care is not just saying, yes, your family is important. It's actually including them on rounds. It's actually involving them in decisions. It's actually sharing our concerns and letting them share their fears, sharing their concerns. It's creating a connection that allows you to partner in the care of the children. I make sure that we have the best available care for their child and make sure that they know it, make sure the child knows it, and make sure that they get the best we have to offer, because their kid deserves it.
The best decision I ever made in my entire life, hands down, was to become an emergency medicine physician, which means that every 15 to 20 minutes, I am presented with an opportunity to make a positive difference in someone's life. That's what I love about the whole thing. I don't care who people are, where they come from. Anytime you get an opportunity to make somebody happy, to make somebody feel good, it's priceless. I feel so fortunate to be able to have an opportunity to do that for somebody in their life. And they pay me to do this.
Doing this type of work is really a privilege to be a part of patients and families' end-of-life journeys. We are honored to be invited into people's homes, to go into skilled nursing facilities, into group homes, into assisted livings, and provide end-of-life care and meet the caregivers who are involved, whether that's family members or professional caregivers, and work together in providing the best end-of-life care that we can.
One of my philosophies about working with kids or adults or anybody in a difficult circumstance is that you have to find a way to fall a little bit in love with every single person you meet. And I guess that's one of the ways that I sustain myself in my work, and I know that we as a team sustain one another.
I think the art of caring comes from within. It's being comfortable with who you are. It's being aware of how you impact your environment and the people within it. It comes from a desire to make things different and better for people. I think if that's where people come from, caring flourishes, whether you've had that classroom education or not. And that's the richness of life, is human connection, being able to be there. If I can't connect, I'm not living. And that's compassion.